Hi everyone, thanks very much for joining us, and thank you very much to our three ST2s that we've got here who've all recently passed the AKT with very high scores. So thank you very much for joining us. I don't know if you each want to just briefly introduce yourself. So Aisha, do you want to start first?
Hi, I'm Aisha, after one of the GP trainee ST2s in Nottingham scheme. I've just recently passed my AKT in the October attempt.
Thanks, Aisha. And could I just check, because I understand you're an international medical graduate, aren't you? Is that where did
Yes,
you
I am.
where did you originally qualify?
Hi. So yeah, I am an IMG from Pakistan. I qualified in 2018, so it's been almost 6 years now. I worked
Fantastic.
in A&E there in Pakistan for about 2.5 years before I started working here in NHS, again in A&E post before I started my GP training.
Okay, that was great. Thanks so much. And Ben, are you able to just tell us a little bit about yourself as well?
Yeah, so hi, I'm Ben. I'm a GP ST2 based in Nottingham as well. I'm a UK graduate and qualified in 2018 and have been in the Nottingham area since graduation.
Thanks very much. And Lamia, you
Yeah,
okay to just introduce yourself too?
yeah. My name is Lamia. I'm also a GPST2. I qualified in Egypt, but not in 2018, in 2001.
Okay.
Worked there for many years. As my specialty was tropical medicine. And then later on, like in 2022, I joined the NHS as a GP trainee. This was my first job in the NHS.
So
Actually.
you were completely new to the NHS,
Yeah,
but you've shown that you can do it. You can pass the AKT
yeah,
really well first time round, so that's fantastic. Well done,
yeah.
everyone. So we'll start just with you, Lamia. Are you able to tell us a bit about when you sort of started revising for the AKT and what motivated you
So,
to start at that stage?
all right. So I started early. So well, I didn't have a plan to join the October attempt, but still I started early, maybe in April or so like that, because I want to be prepared during our first induction session when we had the induction all the GP training. It was made clear that the IMGs has low pass rates than the UK graduates. So you would say that this pushed me to study harder, study more. I know that I was at a disadvantage. So I wanted to bridge this gap as much as I could. I did this by starting earlier. Yeah, so I started in April, something like that.
So you sort of responded very positively to that, didn't it? Because that can be very
Mm.
disheartening, can't it? So
It is. Actually, it was, but I tried to look at the motivating part in it.
yeah, fantastic. And Ben and Aisha, would you have any sort of different advice on when you started and what worked for you?
Yep. So when we say it's proper starting for the exam, as in sit in and study, I started that around June time. But I was doing quite a bit of like online learning, or let's say even if I'm seeing the patient and I'm not sure about the next step after debrief, I would look up at the guidelines. So I was doing that even from my ST1, and then there's quite some useful videos and material on the RCGP website, and I started doing that early on, like from even ST1. So this is quite helpful, and I would recommend everyone to do that whenever you get a minute, even if you're not uh, planning to attempt the exam very soon.
Fantastic. So that's sort of learning from experience and making sure you're looking at the guidelines about every patient that you see when you're not sure what's going on. And what information did you find useful on the RCGP website?
So on the RCGP website, the essential knowledge updates and essential knowledge challenges were quite helpful. The other thing was that they've got loads of clinical videos on all the important topics. So let's say sometimes you're, even if you're not in a mood to study, but you can just, open the video, just keep getting updates, or, just revising the knowledge that you've got. So that was quite helpful. The
Were
other
they
thing.
the videos? Sorry, just to interrupt. Were they on the 14 Fish or RCGP? Which videos were you looking at there?
So I started the AKT the AKT package from 14 Fish a bit later, but initially most of it was the essential knowledge updates and challenges on RCGP website.
Okay, that's great. Ben, I don't know if you've got anything to add about when you started.
Yeah, similar time to Aisha, 4 months before, and kind of part of the motivation was also just helping with being a GP ST1 as well. So mainly helping with seeing patients. It kind of gives you a bit more confidence when you're revising at the same time, because you feel like you want to get to a point where you don't think you've got a massive knowledge gap somewhere. So that was kind of the main reason that I initially started.
Fantastic. So yeah, it's a steep learning curve, I think, isn't it? So actually, if you're getting that revision in early, I think it helps you know your job a bit more, doesn't it? So Aisha, you kind of touched on this. Ben, are you able to tell us a little bit about your sort of revision preparation and what you did?
Yeah, so I initially started by trying to do a mock exam, basically, to see where I was up to. And then also I thought it'd be quite a useful way of structuring revision. So the GP self-test resource has questions that are very similar to the exam and cover every aspect of the curriculum. So I basically did a mock exam, got the results of that, and the way the results are produced are in the domains that the curriculum covers. So you can then see, oh right, I did really badly in statistics, or I did quite well in something else. And then the way I did it is basically started with the domains that I did really badly in, and then throughout over the months then kind of tried to improve on those, and then as time went on, started to work on the ones that I'd done slightly better on. And the way I revised anyway was using the GP self-test question bank and then reading around each question as I went, sort of thing, rather than just either saying yes, I got it right, no, I got it wrong. I'd read the question and then decide what's it asking, what's the question actually asking, what could it ask, and read around those areas basically.
So you started off by doing the mock exam on GP self-test, and then kind of focus things a little bit more from there and drill down a little bit more from there. Lamia, I don't know if you've got anything you'd add, anything that you did additionally or differently at all?
Not anything additional. I started to practice when I was GP as well. So whenever I saw a patient that I was not sure of, so I tend to read the guidelines. When I went home, for example, he was hypertension, this is cardiovascular, so I studied the cardiovascular system. And then maybe the next thing that I saw was, for example, a patient with migraine. So I knew that I had to study the neuro. So I used my GP practice to guide me what I'm going to study.
Fantastic. So I think there's definitely something to be said from seeing patients, isn't it? And seeing a lot of patients and using that as part of your revision.
This is why I recommend, like Aisha said, to do it when you're in the GP's rotation.
Yeah.
Because it helps a lot to see lots of patients and it prompts you to go and study.
Yeah, definitely. Did anyone find anything different on the RCGP website? I know Aisha's mentioned a couple of things and we've gone through GP self-test. Did anyone look at anything like the feedback reports from previous exams?
Yeah, I didn't know about the previous feedbacks report till that teaching. And after that, I went through that. And basically what those reports do is they tell you that, let's say in this exam, most of the people struggled with these topics. And again, if they are important clinically and people are struggling with it, that means that they are most likely to be having a bit more weightage in the next exam, and people are likely to be tested on those topics again. So let's say dermatology or chronic long-term conditions. It's a good guide for you to know that I think these are the topics that I need to work a bit more on, and some of the topics there I actually myself struggled with. So it's a good to use that as a tool to know that definitely I'm struggling with this topic and this will be tested. So it's a good idea to focus a bit more, have a discussion with your supervisors, or just to have a bit more guidance on how to manage those.
So I guess coming on to tricky areas, Ben, did you identify any, tricky areas that you felt you had to focus more on?
Yeah, so I think probably the stuff that you don't use every day in clinical practice, all the stuff that in reality you just look up. So things like the DVLA guidance, the differences between, the GP administration stuff, so stuff like maternity leave rules and things like that. It's not stuff that you use every day at work as a GP trainee. So that was probably the area that was the trickiest, because it just involved fact learning essentially. So I mean, the way I did it was, you've just got to try and clock the areas that are going to be like that. So DVLA guidance, fitness to fly rules, things like that. Clock it early, and then I kind of read around it maybe kind of during my revision, but then made sure that I had some time in the days leading up to the exam to go over those areas again, because that's the kind of stuff that's going to stay in your head for a day or two and then leave again. So kind of made sure that having some time before the exam to have those areas covered again was quite useful.
Really good advice. I think people have said the same thing about this sort of evidence-based stuff as well, that maybe doing that nearer the exam can be helpful. Lamia, I don't know if you found any areas tricky in particular, or anything that you felt you had to focus on a little bit more.
Yeah, the admin part, as Ben said, because as I said, I'm new to the NHS, so I didn't know anything about how it works. Yeah, so I had to go over it multiple times just to be aware of them and the names of the forms and all this abbreviation. Yeah, it gave me a hard time actually.
Yeah. So being new to the NHS, I can appreciate that sort of admin side of general practice must have been completely new to you. Was there anything else sort of clinically that you found you needed to focus on a little bit more, or?
Yeah, so there are some, because I didn't do primary care before. When I was training, I was hospital setting, so I didn't do any primary care. So there are many aspects of the primary care that I didn't know how to manage, the usual stuff. So for example, diabetes, I didn't know how to manage diabetes. I used the patient that I saw as a study material. So I would say that I was learning with the patient. I asked the diabetic nurse about the medication. I would say that I had help with the diabetes, with the hypertension, with the contraception. I didn't know anything about contraception. So yeah, the things that are common in the primary care, I was not familiar with them before, and I learned them.
So you did really well, because obviously you had quite a blank slate, didn't you, for several areas. Sorry, what were you going to say? Something else?
I would say that it's not about struggling. It's about they were new to me.
Yeah.
So I had to learn many things.
Yes. Yeah. Aisha, I don't know if you've got anything to add to that with being an IMG, if there was anything sort of clinically you found.
I had worked in A&E back home in Pakistan, and even before starting GP training here. So there were quite a few things, let's say asthma reviews, the COPD, like the long-term management, which is probably the most common things that we see in day-to-day. Probably even 60 to 70% of our daily interaction is from the people with long-term conditions. And I think a few questions in exam I was able to answer because I had a few sit-in with the nurses when I started in the GP placement in terms of, let's say, COPD review or asthma review. The other thing that helped me, as Lamia said, diabetes, I was a bit scared of. I mean, when I started in GP, all I knew was, okay, you start everyone on metformin, and then it's like probably SGLT2. But then I think if you know your weak areas, and you have to make an effort. I went through the CBC, BNF, I opened all those things. I made my own summary, which we discussed in one of the teachings later on. So that helped me summarize everything on which order to go in. So you know your weak points better than anyone else. And just reflect on it and try to use, we've got loads of, I think, learning material available online. So if you just focus on the points that you struggled with and just do learning around those. That's quite helpful. The other thing with statistics was that I think people usually, and this is what I did, I was just learning the formulas without actually thinking what that means. And it was one of the, we discussed stats in, and after that, I think I found that my understanding of things was not what as good as it should be. So again, you can search even on YouTube, or you can Google, or even the 14 fish videos were quite good, just to try to understand like what sensitivity means. If the patient's coming up, how you're going to have a discussion with them around it. So just getting your head clear around this made quite a bit of difference and helped me get a bit better score.
I think that's really, really helpful. So I think there's two really good bits of advice there. So firstly, maybe look to summarise the BNF, and that will help you in a whole range of areas by the sounds of things. And then I think the second thing you've described is, maybe not just rote learning the statistical terms and that sort of thing, but actually applying them, work out how they relate to patients, what patients might come and ask you about, where you need to explain sensitivity and specificity. There are some good videos with the statistician that are now on the RCGP website as well. They might not have been there when you were doing your revision, but I think that's quite a good resource, which again sort of looks at things in a bit more of a practical way. So lastly, I want to come to everyone and just ask, what is your one top tip that you would give someone who's sitting the AKT? So Ben, if I come to you first, what would your one top tip be?
So I think for me, the using question banks is a good way of structuring revision, but you've got to use it in the right way. So I think just rattling through questions doesn't necessarily help. But if you're reading around each question, even if you get it right, I think that's a good way of doing it. So that would probably be my top tip, is going slowly with question banks, not rattling through 100 at a time, just doing 10, 20, reading around those areas in a directed way. So for example, today I'm doing respiratory and doing those questions. That's probably what I'd suggest.
Fantastic, thank you for that. Lamia, what would your one top tip be?
So I also talk about the question bank. I will add to what Ben said. When you go to the exam, don't expect to find the same questions, because some people keep asking. I've been asked before, which one is similar to the exam, which one is similar to the exam. So the question banks are not similar to the exam. Just use them as a tool to build on your knowledge.
Yeah. So don't expect the answers to be exactly the same.
Yeah, no, it's not. No, it was not.
Fantastic. And Aisha, what would your one top tip be?
So I think my top tip would be to plan on when to take the exam. Ideally, after you've got some GP experience. And the other thing would be to start a bit early on. You don't have to get into that stressed mode that, oh, I've got an exam. But let's say, as I mentioned, start from ST1, but just build up on your knowledge of the things that you see commonly. Again, common things are common, they're tested a bit more in exam. So just build up your knowledge, and yes, 3-4 months before the exam, you can just start to do that, like sit home and study thing. But the sooner you start, the better. And take your clinical experience to guide you to prepare for the exam.
Yeah. Brilliant. Well, thank you so much, everyone. And hopefully that'll be really useful for trainees in a similar position. And good luck in your future careers. Thank you so much.
Thank you, Lucy.
Thank you. Bye.
Okay. Bye.
Bye, everyone.
This is a summary of the discussion with our ST2 GP trainees. Firstly, a common theme was to start early. Make sure you give yourself at least 4 to 6 months to plan and prepare. Even from ST1, read around every new presentation that you see. Prepare to sit when you have had sufficient experience in GP. And you could consider using RCGP Essential Knowledge Updates and Essential Knowledge Challenges. I've attached a QR code here for ease. Initially, our trainees felt that it was important to do a mock exam on the RCGP GP self-test, for example. I've attached again a QR code here so that you can access this. Make sure you read around feedback reports from the previous exam. These can be found on the RCGP AKT section of the website. Focus on areas in which you feel less strong and make sure you're learning from patients and looking up national guidelines when you are unsure of a presentation. Other revision suggestions. Sit in with practice nurses to learn more about chronic disease management or the specialist diabetes nurses. Consider which private question bank works best for you. Make sure you attend AKT teaching arranged by your local training scheme. Look at the How to Prepare for the AKT section of the RCGP website, including Professor Mike Harris's data interpretation videos. Again, I've attached a QR code so that you can access these straight away. You could consider summarising the electronic BNF, starting with the Medicines Guidance section. Remember, up to a third of AKT questions involve prescribing knowledge. Consider areas which may be new to you if you are new to the NHS, for example, administration or specific clinical areas. Go slowly with question banks and read through each area. Nearer the exam, make sure you focus on areas which you would usually look up, for example, administrative topics and data interpretation. You could use this opportunity to also revisit trickier areas you have identified. And finally, good luck. Many thanks to the ST2 GP trainees involved in the making of this video.